Hi, my name's Ruth Turner and I work at the Deafness Resource Centre in St Helens, and we're an organisation that supports deaf and hard of hearing people. It generally tends to be information, accessibility to information in a format that's useful for them, and also communication. It's been really quite an issue since COVID, because obviously within a medical profession everybody is masked up all the time, and obviously quite rightly so, but it makes it so much more difficult for people that have a hearing loss or are profoundly deaf to access information direct from face-to-face consultations. So you've got two aspects really. You've got the accessible information where you may get a leaflet about a medical condition that you've got, or you may not know you've got a medical condition because you don't pick up information. Hearing people will pick up information all the time without even knowing about it. We might be in a room having a conversation, there might be something on the radio or the television, and subliminally we'll pick up that information, but a deaf person doesn't. So it's access to information, and it's when it's a face-to-face consultation, it's actually being able to be part of that consultation. And it tends to be more difficult for people that have hard of hearing because they rely so much more on lip reading. They can't lip read because there is a mask on. They're not allowed generally to take anybody with them because it's appointment only. You know, you can't take your best mate or your mum or your husband or wife like you used to be able to, unless you know that you're going to be given some really serious information, and then usually you're asked to bring somebody with you. But it's all those appointments leading up where you've got to go on your own, and hard of hearing, it's really, really difficult to lip read because of the mask situation. And then with a profoundly deaf person that communicates with sign language, you've got to hope that someone has picked up on the fact that you need an interpreter and has booked an interpreter for you. We do a lot of work with hospitals around the need to make sure that if you've got a patient who's listed as having their first language as British Sign Language, then they should be and must be supported by a sign language interpreter. And that's really key, because so many people could have their condition managed so much better earlier if they understood about the condition, or they understood what they might have. And if they had proper access to information, and when they see the GP, if they understand their medication. But it's at that first point of presentation, that person needs to be supported with their form of communication all the way through their journey for whatever condition it is that they've got. It's a heightened risk of anxiety. You know, if you've got a person who's hard of hearing or who's profoundly deaf, and they go to a consultation or they present at a GP surgery and they feel that they've got something wrong with them, it's the problem of getting that over if they're not properly supported, and that increases their anxiety. It can often result in them not being able to explain what's wrong with them properly, because potentially they might be trying to do it by writing things down if the doctor hasn't got an interpreter there. If the doctor's not facing them, they might feel that they're not getting their information across. They might feel they're being rushed, because it generally takes a little bit longer with a deaf person to try and explain what's going on, because they don't understand. They might ask to repeat something, and then you might get into what we call the nodding dog syndrome, where a deaf person doesn't want to appear to be stupid, so will nod and agree, and then come out and have no idea really what's been said to them, or end up with a prescription for something and not really know what that prescription's for, and indeed how to take it. In St Helens, we had a number of sessions within our deaf club where the health and wellbeing group were coming in and they were talking about different forms of cancer. And one of the sessions that we had was regarding bowel cancer and the bowel cancer screening. And quite a number of our clients had said that they'd received their packages within the post and didn't really know what they were for because it was all in English, so they'd not done it. And we had one gentleman who came to us afterwards and said, that he'd had actually blood when he was going to the toilet, and he'd seen it on the toilet paper, and did we think he should do something about it? So we were absolutely, you need to do something about it. Got him booked into his GP, got him organised with an interpreter as well, went through the procedure, and he had actually got quite advanced bowel cancer, but he'd been seeing blood for quite some time, quite a number of months. So he had no idea about cancer. And this was an elderly gentleman who was retired. He didn't understand that you could possibly get bowel cancer, and that blood in your stools and on the toilet paper was one of the sort of alerting signs. And unfortunately, he passed away because at the stage that he was diagnosed, it was too advanced. I'm hoping that things are different now, but certainly 10 years ago, we were doing some work on different health conditions that we felt that they should know about. And at the time, I couldn't get anything from the NHS on prostate cancer, on testicular cancer, absolutely nothing. I had to go to the support groups for those cancers to actually get anything in BSL. So I'm hoping that now a lot of the information has been changed, and it is one of the languages that is considered, because back then, and literally it was only 10 years ago, I was told by NHS England that less than 2% of their DVDs were in sign language. And it's great that everybody's catered for in a video, it's so important, but so's the deaf community. You know, they're important too, and they shouldn't be forgotten. Right at the initial consultation, or even before if possible, when they get their letter to say that they're coming, there should be something really highlighted about the opportunity for them to be able to let services know that they need a sign language interpreter. And then at the first consultation, part of it should be, how do you want us to communicate with you? And that should be marked on their file, so that all the way through their journey, whoever picks up or opens up their computer to talk about that person knows that they need to have sign language interpreter with them whenever they have, say, a ward round or doctor's visit or a consultation of any description. They need to have somebody there that explains that process. They're entitled to receive communication support in their preferred way. So, for instance, we have some of our clients who are really hard of hearing. They use lip speakers. So again, if somebody requires a lip speaker, then it's the responsibility of the service provider to make sure that they've got one with them. British Sign Language interpreter, that's important for them to have. Some people, they like to take a note taker with them so that they are watching the interpreter, but they've also got somebody taking it as notes as well. It really is dependent on what that person wants for communication support, and everybody can be different, but everybody can be accommodated if staff know the right way of doing that. I think it is that services are accessible to everyone, and that however you present your either information or your consultations, you consider that not everybody is hearing, that not everybody speaks the same language, and that whilst there are very many different spoken languages, also sign language is a language in its own right. You know, people don't think twice about picking up the phone and getting a foreign language interpreter, and they shouldn't think twice about making sure that a deaf person is supported by a sign language interpreter as well. I think it is that in the huge and 99.9% of cases, when a person that's hard of hearing or profoundly deaf is let down by a hospital, it's never through malice or because people can't be bothered. It's because they don't know, they don't understand, they don't have that awareness of what's needed, or they know that they're perhaps not getting it right, but they don't know what is the right thing to do. A lot of people still don't understand that people that are profoundly deaf, English isn't their first language. They think that if they write it down, that person's going to understand them, and it isn't always the case. They don't know how to access sign language interpreting. They don't know. And with the best will in the world, you know, a nurse that's running around trying to do 300 things to try and then work out how to get a sign language interpreter, it's just more time that they literally haven't got. So everything needs to be really at their fingertips, you know, and it's, again, that's awareness for staff. So it's training from the organisation that this is what the staff need and this is where you go to get it. You know, it's everything has to be made so much more streamlined to make sure that the client stroke patient gets the support that they need.